Thank you, Madam Chair, and welcome Secretary Shinseki and your team. Two things I'd like to raise. The first is just to note my continuing objection to the President's decision to put the so-called Chained CPI benefit cut in for Social Security recipients and for disabled veterans. The context for this is that a 100% disabled veteran who begins to receive benefits at age 30, which is not unheard of considering the young men and women who are sustaining very significant injuries overseas now, would see $1,425 less a year at age 45, $2,341 less a year at age 55, and $3,233 less a year at age 65. And as you know, we're not very profligate in our spending on these veterans. This is a pinch that they will really feel. And my take is that, at least with respect to Social Security, the COLA is too low already. When you look at the kind of things that seniors and disabled veterans are likely to be spending their resources on, it's food, it's health care, it's heat, and to a degree perhaps also gasoline. When you look at those things, you look at 2010, food was up 1.5%, medical care was up 3.3%, gas was up 13.5%, fuel oil was up 13.5%, the COLA went up 0%. Strikes me that for that year the COLA was too low, not too high. You go to the next year, food was up 4.5%, healthcare was up 3.5%, gas was up 9.5%, fuel oil was up 14.3%. That's on top of the increases in the previous year, not incorporating them. So you'd actually have to sum those increases and add a little bit for the compounding. Again, zero in the cost of living adjustment. So I think that this is a very misguided strategy, and I just want to serve notice to everybody in the administration who has a role in this that I intend to fight it with whatever means I have at my disposal. The second piece that I want to, you can comment on that if you want, but let me get the question I have to you out, which is something specific to Rhode Island. You've been to Rhode Island a couple of times to visit Senator Reid and myself, and each time I've talked to you about the problem we have that the VA has a terrific electronic health record, but if a veteran gets hit by a bus in Kennedy Plaza and rushed to the Rhode Island Hospital emergency room, it doesn't do them any good because the VA record is enclosed within the VA system. Rhode Island is one of the most advanced states in terms of developing electronic health records and providing true interoperability among different components. And we are working very hard to try to integrate the VA into that process. It is not easy. There are technical problems, there are funding problems, and so forth. But what I'd like to ask you to do is to convey your view, if it is your view, down to the folks in Rhode Island that this should be a priority for them. And to the extent that the so-called VLER program, the Virtual Lifetime Electronic Record Initiative, is extended, I'd like to have Rhode Island become, I think you call them VLER, a VLER site. I honestly don't think that there is a state that is further ahead than Rhode Island in terms of developing an interoperable electronic health record. There are individual companies that are where you can have a CEO direct, here's what we're going to do. But in terms of a whole community of everybody from the imagers to the laboratories to the hospitals to the providers, I really think that we're at the forefront. And I would ask that in the spirit that we should be doing what we can in this area to let the lead dogs move faster, to put an asterisk next to the effort in Rhode Island and try to give it some of your and your staff's direct personal attention, if you could do that. If you could respond to both of those, if you wish.
Well, Senator, on the first issue, the Chained CPI proposal, I would just say thanks for your statement here. I would also point out that the President's been very clear in his consistent desire to protect vulnerable populations. The proposal excludes being tested veterans' pensions, which are provided to low-income, wartime veterans who are age 65 and older, or who are under 65, but remain totally permanently disabled as a result of conditions unrelated to military service, and I believe that addresses some of your concerns.
Only a little bit, just because of the numbers involved. The President identifies $230 billion in savings from the so-called Chained CPI benefit cut, and all those programs put together that you mentioned put back $15 billion. So there's still a huge whack that's taken out of the populations that are subject to Chained CPI, and the amount that gets brought back is pretty small, less than 10%. It's whatever percentage 15 billion is of 230 billion.
I would also include that the budget proposal excludes certain veterans' education programs as well. Post 9/11 GI Bill, Montgomery GI Bill for active duty, those inflationary adjustments are decided elsewhere, so they're not included under Chained CPI.
And on the VELA program in Rhode Island?
On the VELA program, I would say we have been very aggressive in our outreach between VA and DOD in terms of record sharing, and then a number of pilot test events, West Coast and East Coast, between VA, DOD, and the civilian community. And you know, I regret that we haven't made it up to your home state yet, but I do recall our discussion, and that's something I'd be happy to explore with you.
If you could review it, give it a little bit of moment of your personal attention, talk to your senior staff about it, see what we can do, that would be helpful to us. Sure. I truly believe there's actually, Madam Chair, quite an interesting report in the Help Committee written by the minority criticizing the so-called high-tech bill that provides for meaningful use of electronic health records in the private sector, that it didn't focus enough on interoperability. And I think they're actually dead right about that. So I think you need to put your resources where the lead dogs are. The pack will never run faster than the lead dogs. Move out the lead dogs, and let's get this done. Thank you.